In this video, I'm going to discuss hydrocephalus. What is hydrocephalus? Hydrocephalus is a buildup of cerebral spinal fluid in the cavities of the brain. It is also commonly known as water on the brain. There are three types of hydrocephalus: congenital, acquired, and normal pressure. Congenital hydrocephalus is present at birth. It may be caused by an infection in the mother during pregnancy. It is one of the most common developmental disabilities. Acquired hydrocephalus develops after birth, usually after a stroke, brain tumor, or as a result of a serious head injury. Normal pressure hydrocephalus only affects people aged 50 years or more, and it may develop after a stroke or an injury. There are many clinical manifestations with hydrocephalus. Symptoms of hydrocephalus vary with age, disease progression, and individual differences in tolerance to the condition. Some of the symptoms in infancy are vomiting, increase in head circumference, irritability, and seizures. In older children and adults, some symptoms seen are nausea, vomiting, blurred or double vision, urinary incontinence, and unsteady gait. As the disease worsens, some may start to experience memory loss and slowing of movements. The current diagnostic testing done is CT scans, MRIs, and pressure monitoring techniques. There are only two types of treatments for hydrocephalus currently: shunt insertion and third ventriculostomy. The most common treatment is a shunt insertion. The purpose of the shunt is to drain excess fluid from the head to another place where the body can remove it naturally. Shunts have valves that regulate both the direction and the amount of fluid that is drained. Most people diagnosed with hydrocephalus will need a shunt for the rest of their lives in order to keep the cerebrospinal fluid off of the brain. They also prescribe diuretics and rehabilitation and educational therapy in children. So, my nursing diagnosis is ineffective cerebral tissue perfusion. The goal for this is to maintain adequate cerebral tissue perfusion. In order to do so, I would need to maintain bed rest with head of bed flat, monitor and record neurological status, and monitor heart rate and rhythm. The expected outcomes of these interventions would be improved level of consciousness, no presence of seizures, blood pressure within normal limits, and no headaches. The first NCLEX question I have for you is: a client with hydrocephalus is scheduled to have a ventroperitoneal shunt in the right side of the head. When developing the plan of care, the nurse would expect to place the client in which of the following positions immediately after surgery? A. On the right side with the foot of the bed elevated. B. On the left side with the head of the bed elevated. C. Prone with the head of the bed elevated. Or D. Supine with the head of the bed flat. The answer is D. The rationale: for at least the first 24 hours after insertion of a shunt, the child is positioned supine with the head of the bed flat to prevent too rapid a decrease in the CSF pressure. Positioning on the operative site is to be avoided because it places pressure on the shunt valve, possibly blocking desired drainage of the cerebral spinal fluid. Question number 2. A nurse is assessing a 3-week-old infant admitted to the pediatric unit with hydrocephalus. What finding identifies a complication requiring immediate attention? A. Tense anterior fontanelle. B. Uncoordinated eye and muscle movement. C. Larger head circumference than chest circumference. D. Inability to support the head while in the prone position. The correct answer is A. Tense anterior fontanelle, and the rationale is: a tense or bulging fontanelle is indicative of increased intracranial pressure, which is caused by the fluid accumulation associated with hydrocephalus. Conjugate gaze does not occur until 3 to 4 months of age when eye muscles are mature. The head is the largest part of the body at this age. The head circumference should be about 1 inch larger than the chest. An infant cannot support the head before 1 to 1.5 months of age. And this concludes my presentation on hydrocephalus. Thank you for listening.